October is Breast Cancer Awareness Month. According to Shared Health, it's estimated 1 in 8 Canadian women could develop breast cancer during her lifetime. That's why Shared Health hopes to raise awareness about it and the importance of early screening. Joining us now is the Medical Director of the Breast Health Centre, Dr. Duncan Inglis. Good morning, Doctor.
Good morning.
Thank you for joining us.
Thank you.
Now, some of these numbers, they're quite shocking that breast cancer is the most common cancer among Canadian women.
Correct.
Excluding melanoma. Is that right?
Yeah.
Okay, so what do you want women to know about this?
I think the big thing is we just want people to be sort of aware that breast cancer is out there. We talk about the 3 B's, which is sort of be aware, be healthy, and be informed. So basically, you can sort of access information from your family doctor and the screening programs that there. If there's a concern that they see, to access their primary care provider to get investigated and get some help.
What are things that you can do at home to sort of do your own screening?
We just recommend that you should be aware of your breasts. If there's something different or changes, then that's something that you should seek, help for. We encourage women to be healthy, sort of active lifestyle, maintain appropriate body weight, limit their alcohol. So those are important things too.
But early screening is also very important.
Correct.
And the rules before were 50 and up, right?
Correct.
For early screening. Those have changed because we know that there are many women that experience breast cancer before they turn 50. And so what are the new rules when it comes to early screening in this province?
The big thing we want to do is we want to try and increase the 50 to 74 is really where we want to increase the percentage of women who are screened. We'd like to get that to be a higher percentage, so we're trying to access people which are more difficult remote areas or people who are maybe reluctant to screening to encourage them. We have opened up sort of screening to talk to your provider between the 40 and 49, and I think there's pros and cons of screening at the younger age, and we encourage people to have that discussion with their provider to see if that's something that they're interested in, or versus just continue on at the 50 to 74.
There's also a concern for some women that might have dense breasts, that the mammogram isn't necessarily a good way to monitor whether or not there's anything going on there.
Yeah, the dense breast does increase your risk of breast cancer, but all the screening programs were done and the studies were done on women with dense breasts as well.
Okay.
So the screening programs do apply to the people with dense breasts.
Okay, so what do you want women to know? What should they do?
Well, I think the big thing is if you're especially in the 50 to 74 category, get screened. The breast screening program will contact you. You can contact your healthcare provider and they can sort of set you up with the program. Okay. It's an excellent program. It has a mobile unit, so we reach all across Manitoba. If you have any questions, that's the first step. And you can also contact the Breast Check program.
So you don't get a letter in the mail saying it's time for your screening?
You will at between 50 and 74,
okay.
Correct.
Okay, so then once you've had a mammogram, how long is the in-between window for the next exam?
Recommendation is every 2 years.
Okay, so are you responsible for that, or are you getting a letter from the province at that point?
Usually they will send you a letter, and if you think that you've missed or something, you can always reach out with the Breast Check program.
And if you do find something you're concerned about, what do you do at that point? Do you contact your doctor?
Yes, so we encourage people, if you find that there's an abnormality that you're worried about, is not to go through the breast screening program, actually go to your healthcare provider, because then that will be sort of fast track to get diagnosed.
And self-exams, is that still something that women should be doing?
We tell people to just be aware of your breasts.
Okay.
We don't recommend sort of monthly breast self-exams. That was sort of advertised before, but it's more sort of being aware. If you think there's a change in your body, your breast, then you should contact your healthcare provider.
So look at yourself in the mirror, for example.
Yeah, most people find their breast cancer just in their everyday activities, in showering, putting their clothes on. That's when they find it. If there's a concern, then we're always happy to see you.
Okay, anything else?
No, I think the big thing is just sort of be aware and just sort of access the screening programs. We're really trying to promote that to increase that percentage of people who are actually getting screened.
And again, the best way to do that is to contact your doctor. Thank you, doctor, for sharing this with us.
Thank you. Thanks for having us.